Hello, I'm Dr. Isabel and I'm going to show you how to use a take-home whitening kit. There's a couple different types of whitening products that you can get from your dentist. One of them is in the office, and the other option is one that you can actually do yourself at home. And so that home kit consists of custom-made aligners, or trays we call them, that are custom fitted to your teeth so that you can use them to put the whitening gel in. The benefit of using something that is made at your dental office is because it's custom fitted, there's a lot less chance that the gel will get onto your gums. The reason that's really important is when the gel gets onto your gums, it can actually do some damage. So it can cause chemical burns. The good news is that they do heal. It's just a little bit painful for the time being. Now, the whitening gel that we're using, it contains a type of peroxide actually. It's called carbamide peroxide. Because at your dental office, they can make you these custom fitted trays to make the delivery a lot safer. The percentage that you can get from your dentist is higher and more effective than the ones you can get at the drugstore, because there's a higher risk at the drugstore of it getting all over your gums or into your mouth, where you could also potentially swallow more than you need to. So we're gonna open the gel, so there's a little cap that you can pull off, and it actually becomes a seal once you've used it, because this tube will last you a few tries actually. So when you have your tray, you're gonna take the gel and put a droplet of it into the separate tooth wells. And you only need a small bit, I'll show you how much, and you also only need to place it on the front surfaces of the teeth. You do not have to whiten the inside of your teeth. So we're gonna start here at the premolars. You don't have to whiten further back because those teeth don't really show in your smile, and that's about the amount that you want. So we're gonna put a little droplet in each, so it's really small amount, I'd say approximately a grain of rice, and we're gonna place it on each little tooth well up to the premolars, and we're ignoring the last two teeth because, as I said, you don't really need to whiten those back teeth. So here's the bottom tray. So same thing, you only want to whiten the outer surfaces of your teeth. You don't need to whiten the inside that's close to your tongue. So now I've got the gel in my two trays, in my upper and my lower one. They're ready to be put on. So when you insert the tray, if any of the gel seeps out, you're just going to want to take a tissue and wipe it off. There's two different types of gel we have. There's one called day white or night white. The night one, in the name, you can put these on and go to sleep with them. The daytime ones, you can place them on and wear them for 30 minutes to about an hour. And you can do every day for about 2 weeks, or if your teeth do get a little bit sensitive, you can skip a day. Once you remove your aligners, you can just rinse them with warm water and clean out any of the gel that's stuck in there. With whitening, it's always best to do it on clean and healthy teeth. So make sure you have a cleaning before you do your whitening. A dental cleaning will remove a lot of the surface stains and make the whitening results even better. The other thing that's important is it's always a good idea to brush your teeth before you're putting on your whitening trays. After you've whitened, wait at least half an hour before you eat and drink. And if your teeth do get sensitive, which is a common side effect, it's a good idea to skip a day. And also it's great if you can use a sensitive toothpaste, it really helps. As soon as you remove your whitening trays, be sure to rinse your mouth very thoroughly. If you want to use a toothbrush very gently to just remove some of the excess gel that's still in your mouth, go ahead and just try not to swallow the gel. The other thing that's important is avoid eating or drinking anything that could be potentially staining, especially for the first half an hour to an hour after doing the whitening. Thank you so much for watching. Hope you enjoy your white, bright smile.